How to navigate Medicare's complex choices. Are you already on or new to Medicare and turning 65? Your mailbox is probably overflowing with confusing Medicare mail. You're hearing terms like Part A, Part C, and Medigap, and you're worried about picking the wrong plan. Don't worry. This video is your simple map. We'll cut through the noise and break down the two main paths you can take: Original Medicare and Medicare Advantage. By the end, you'll understand the key differences and be able to choose with confidence. The two fundamental paths. First, you have to choose between two main setups. Path 1 is Original Medicare, the traditional government program. Part A covers hospital stays and Part B covers doctor visits. But it has gaps. It doesn't cover most prescriptions, dental, or vision. Path 2 is Medicare Advantage, also called Part C. These are all-in-one plans from private insurance companies. They are required to cover everything Original Medicare does, but they usually add in drug coverage and other perks like dental and vision. Freedom versus structure. Now for the biggest trade-off, your access to doctors. With Original Medicare, you have freedom. You can go to any doctor or hospital in the US that accepts Medicare, and you almost never need a referral to see a specialist. Medicare Advantage plans are more structured, like an HMO or PPO. They use a network of local doctors and hospitals. You generally need to use that network to keep your costs down, and you'll often need a referral from your primary doctor to see a specialist. The critical difference in costs. How you pay for care is also completely different. With Original Medicare, you'll pay your monthly Part B premium. After your deductible, Medicare covers about 80% of your medical bills, and you pay the other 20%. Crucially, there is no annual limit on that 20% share, which can lead to catastrophic costs. That's why many people buy a separate Medigap policy to help cover that 20%, plus a separate Part D plan for prescriptions, which means more monthly premiums. With Medicare Advantage, you still pay your Part B premium, but many Advantage plans have an additional monthly premium of $0. You'll have copays when you get care, but here's the key. Every plan has an annual out-of-pocket maximum. This protects you from unlimited costs, and drug coverage is usually built in. So which path is right for you? So what's the better choice? It really just depends on you. Original Medicare paired with a Medigap plan might be your best bet if you value the freedom to see any doctor and want predictable monthly costs, even if the premiums are higher. A Medicare Advantage plan could be the right fit if you want an all-in-one package with lower monthly premiums, the safety net of an out-of-pocket max, and you're comfortable using a provider network to get extra benefits. Conclusion. Ultimately, the choice comes down to your personal health, budget, and lifestyle. If this breakdown helped make things clearer, subscribe for more simple, straightforward guides to help you navigate your healthcare.